This is the Department of Human Services Family Child Care Orientation. Module 1, Introduction. Welcome. We're so glad that you are interested in learning more about licensed family child care. Have you ever imagined yourself caring for children in your own home? Does the idea of partnering with families in the raising of their children interest you? This orientation is designed to give you more information about what it means to have a licensed family child care program in the state of Minnesota, as well as an overview of family child care licensing requirements. What is family child care? Licensed family child care is care of children that takes place within a provider's own home. Programs are typically operated by one individual who is licensed to care for up to 12 children. The children who attend are typically mixed ages ranging from 6 weeks old to 10 years. Providers can build their own unique businesses while following licensing requirements that provide for the health and safety of the children in their care. Other types of child care. Licensed family child care is just one type of child care available to children and families in the state of Minnesota. If you would like to provide child care for just one unrelated family, that is called legal non-licensed child care. The term related means that there is an established relationship by marriage, blood, or adoption. A legally appointed guardian is also considered to be a relative. Providing child care for more than one unrelated family requires a license. Another type of care is called special family child care. Special family child care is child care serving 14 or fewer children that takes place at a location other than the license holder's own home. Providers of this type of care follow the same laws that govern family child care and are licensed by the county/agency in which the program is located. Child care centers operate in a location other than the provider or caregiver's home, with larger numbers of children being cared for. They are licensed by the Department of Human Services. Certified child care centers are those that are excluded from licensure but wish to receive Child Care Assistance Program, CCAP, funds. They are also licensed by the Department of Human Services. The focus of this orientation will be on licensed family child care. If you would like to learn more about these other types of programs, you may reach out to your county licensing team or the Department of Human Services. Who are family child care providers? Family child care providers are as unique as the homes in which they operate their programs. The most important quality of a provider is someone who enjoys working with young children and their families. They are people who enjoy working independently and are interested in running their own programs. Providers must be physically able to provide care for young children for multiple hours each day. Family child care providers are people who make a difference in their communities by providing safe, healthy, and learning-rich environments for children. What is licensure? The state of Minnesota licenses over 8,000 child care programs with the capacity to provide licensed care for about 222,000 children. Licensure provides the necessary oversight to ensure child care is provided in a healthy and safe environment, provided by qualified people, and can meet the developmental needs of all children in care. Licensors review 4 main categories of requirements when they visit programs. The first is health, safety, and ratios. Examples of what a licensor checks in this area are: how does the provider clean the child care area? Is there a first aid kit available? Does the provider care for the number and ages of children allowed by the license? The second requirement has to do with training. Examples of what this includes is current first aid and CPR training for all caregivers in the program. The third requirement area is the program's physical/facility standards. When checking for this, a licensor will look at things like: do the stairs have safety gates? Are there working smoke and carbon monoxide detectors? The last requirement area involves background studies. All caregivers in the program, as well as household members ages 13 and older, must have cleared background studies. More detail about these areas of licensure will be covered during the course of this orientation. How do I know what is required of me as a licensed family child care provider? Providers must meet a variety of health and safety standards, which are listed in both rule and statute. Minnesota Rules, Chapter 9502, also known as Rule 2 Minnesota Statutes, Chapters 245A, 245C, and 260E. If you are new to rules and statutes, you may find the Minnesota Office of the Revisor of Statutes website to be helpful. During the course of this orientation, we will provide greater detail around these standards. What steps do I need to take to become a licensed family child care provider? This flowchart demonstrates an example of what a typical licensing process will look like. Please note that the order and steps may slightly vary by county. The steps to becoming a licensed family child care provider are as follows. Contact your county licensor and express your desire to become a family child care provider. Complete the family child care application and return it to your licensor. If needed, complete a fire marshal inspection. Register for and complete all necessary background studies. Read and understand all licensing rules and statutes. Complete the required pre-licensing training. Write your program policies. Obtain a physician's statement of medical exam. Complete all the required licensing paperwork and submit it to your licensor. Complete a pre-licensing home inspection with your licensor. Receive your family child care license. Interview potential families and open your program. What should I expect from the rest of this orientation? This is intended to be an overview of licensing requirements. It will not cover everything you need to know to become licensed. Your county licensor will work with you to ensure you have everything you need to successfully complete the licensing process. Throughout the orientation, you will be introduced to content in both formal rule and statute language, as well as in plain language. The orientation is intended to be done at your own pace. The sections may be viewed in any order and you may return to view the content as frequently as you wish.